Ladies and gentlemen, we're going to begin panel 7, Delivering Healthcare Access and Equity, What Works in Our City, sponsored by VillageMD. And our moderator today, Mayor Justin Bibb of Cleveland, Ohio.
Thank you. Good afternoon, everybody. They got me on double duty today. Well, I'm so excited for this conversation as we reflect and really think about the importance of health equity and health access in our communities. We couldn't have anybody more important than these two amazing guests. We have the CMS Administrator Chiquita Brooks-LaSure, as well as my fellow Alpha brother, Mayor Sylvester Turner, as well, too. And I had the chance to host the administrator in Cleveland during my first year in office at one of the leading hospitals in our city, University Hospitals, really talking about the challenges we were seeing in Cleveland as it relates to our health disparities. And I want to start with the administrator. In your perspective, how would you define health equity, and how does that definition really impact some of the challenges that Mayor Turner and I are seeing in our respective cities?
Sure, and please let me start by thanking you for having me today. I think, we are just at such a critical moment in our history, and I've been talking about this a lot, how I think COVID-19 has really shown a light on disparities that always were there, but now there's a new willingness to talk about it. And I'm so glad you asked me the question of how do we define health equity, because we talk about it a lot, and the big question is, do we even have a common definition? And we have really tried to be very intentional at CMS about defining it. It is making sure that people can attain their optimal health, regardless of the stat, whatever that characteristic is, whether it be race, whether it be ethnicity, sexual orientation, geography, socioeconomic status, so on and so forth. And so the point is that regardless of the characteristics that you see about someone, every person in this country, every American should be getting and really have access to the care that they need to obtain their optimal health. And what we are seeing across the country, which is generations and decades in the making, are real disparities across so many healthcare factors. And we see disparities in maternal health, in mental health. We were focused very much in that visit to Cleveland about infant and maternal health mortality, touring a facility that really is making, I think, great gains in disparities by being humble, asking questions. One of the things I really loved about the visit was just hearing from the hospital about how they had pursued a couple of strategies, and in talking with the patients, talking with the families, discovered that's not what they needed. And so really trying to have a holistic view about health. So health is certainly getting access to care, seeing your doctor, seeing your nurse, but also making sure that you can put clothes on your kids' back so that you can make sure your kid has enough food, making sure that when you try to have a mental health visit, that it's not in a very visible place, so there's privacy. It's really thinking about the person really holistically, and I think that that is what it's going to take to really move the needle on some of the disparities that we have across the country. And what the work that you all are doing as mayors, you all do things. I think that's why the president loves you, right? You do things. And I think some of the efforts that you all are making to try to integrate some of these perspectives is really important, especially as we're one lever, we're one part of it, but you all have a broader purview, and it's incredibly important that those things are coordinated.
Mayor Turner, you're leading one of the largest cities in this country, a diverse city, a global city. How do you view health equity from your lens as mayor?
Thank you, Mayor Bibbs, and good to be with you, and of course with the administrator from CMS. It's our first time on a program together, so good to be with you. In simple terms, number one, I agree with everything that the administrator just said. I look at it, people's needs are being met. People's health care needs are being met in very simple terms. And I'm not talking about just when people find themselves in a situation where they need to go and see a doctor or to the emergency room or to a hospital, because in large part, your health needs are met even before you get to that stage. How do we keep people healthy so that they don't reach that point? And so if we just focus on when people need to go to the hospital, to the emergency room, we're already late. Yep. And equity has not been met. So if you want to talk about, okay, equity, once somebody needs to go, then people need access, and it needs to be affordable. And if it's not affordable, you don't have access. And so equity for me means that regardless of what zip code you live in, you don't have that disparity. People need access to primary care, and then they may need access to specialty services. And if they don't have access to primary care or to need for specialty services, then there is not equity. And then we have to make it where they can attain it. Yeah. And what I am finding, if you have insurance, private health insurance, for example, and it's good insurance, then you have many options, okay? But if you don't have insurance, and I'm just not talking about physical illnesses either, mental services, people with disabilities, all of that's factored in. But the bottom line for me is that we are meeting people's needs on the preventive end in an equitable way, and then at the same time, when people find themselves needing medical attention, healthcare services, that they can get it, it's accessible, and it's affordable.
You know, one of the things that we saw during the COVID-19 pandemic, George Floyd is murdered, and we see probably the biggest racial reckoning in America since the assassination of Dr. King. And you had a flurry of cities and states stand up loudly and declare racism as a public health crisis. Right. We did in Cleveland. That led us to really think differently about the role that public health plays in exacerbating some of these healthcare disparities. Everything from the fact that if you're less likely to have access to a grocery store within 15 minutes, you're more likely not to get the fresh foods you need to live a healthy life. If you're less likely to have a job that you can get to within 15 minutes on a bus or drive or walk to, you're more likely to be underemployed, particularly when you're in the working class of our economy. And so, Administrator, from your lens, as you think about these historic federal investments we're getting from this amazing president, by the way, probably the most pro-city president we've ever had in history, how can we as mayors work more directly with the federal government and your leadership to make sure that we are truly using this moment correctly to address these structural age-old problems?
Well, it is certainly going to need to be a collective mission for us to move the needle on where we are as a country. And as I said, you know, some of our challenges are decades in the making. It's going to take a real effort. I think that the way I see CMS's role, and you all may know this, but I try to remind our team and others, Medicare and Medicaid were what desegregated hospitals in this country, right? I mean, it is a powerful thing for the biggest payers to say, these are priorities to us. And that is what I am trying to bring to the agency, that as we look down the lens, as we're making our policies, how can we be thoughtful? And so many of our programs are, the Medicare, we're setting the standards federally. Medicaid, we're setting, your states are setting a lot of the rules. I would say a couple of things in terms of how you all can partner. Sometimes it's bringing those wraparound services and really helping to make sure, we're thinking holistically. I would also say that one of the biggest things for this year is making sure that people retain Medicaid coverage and stay on or move to whether it's marketplace coverage, whether it's employer-sponsored insurance. This is going to be one of the biggest things over the next 12 months. And just as the mayor just said, you don't want to get your care when you're at the hospital. That's too late. So what we need to do is make sure that people are getting services way before, and that the basic requirement to get those really services is that you have insurance. I like to say it's necessary, not sufficient, but it's necessary for us to have access to care. So I think also just really partnering with your states, partnering with us, partnering with advocacy organizations to make sure that people get enrolled is, I think, one of the most important things that we all can be focused on in this coming year. I also, though, will add one more thing. I think there are a number of, over the last couple of years, the president has really made so many major changes and been really successful with Congress in passing more benefits. Last year was the most change in mental health services probably since Medicare and Medicaid were created. And those are things that people don't know. The drug benefit is huge. It is huge, and I do not say this lightly. I hear about the drug costs more than anything else I hear about. It is affecting people, and it's really affecting communities of color. And so, and what we find is that when people know about them, they're excited, but we still have really low understanding of what's been passed. So those are two things that I would just say that really partnering to make sure everybody in your cities really knows what's available is a huge thing that you can do in addition to all of the policy that we're talking about, because we're one agency, but you all have a different level of reach and can often be more trusted messengers, which is another thing that we find is important.
Mayor Turner, through your tenure as mayor, you've seen so much, have led on so many issues. From your point of view, what's been kind of your secret ingredient to partnering with this administration to make sure you're delivering on healthcare equity needs for your constituents?
Look, I give a great deal of credit to the administration for providing additional resources. There's no question about that, and I commend them highly for that. And the sensitivity that exists is important because cities need partners. We need partners. What I would add to that, though, is sometimes the same mechanism that we use is not effective in reaching the people who need it the most. And what I mean by that, feds can provide the initiatives, the resources, Medicare side. It can come down to the states, Medicaid side, but you need partners all the way down the chain. And if you're living in states where they're not meaningful partners, like the state of Texas, okay, then you're not meeting the needs of the folk that live in our cities that need the help the most. And so we have to look at ways to create what I call innovative and even a paradigm sort of shift, where we have to look at how do we get the healthcare services and the benefits down to the people who need them the most, even when a state like Texas refuses to engage in Medicaid expansion. Because in the city of Houston, as prosperous as we are, 29% roughly of our adults in Houston don't have access to insurance. And a significant percentage of those happen to be children. And then when people in our city, those in vulnerable communities, are constantly on the margins of life, and you're dealing with storms, and you're dealing with COVID, who are the people most likely to get sick or die? And those are the folk in those vulnerable communities. And the current model, even when you have a super partner like the feds, like you all are, only doesn't address those inequities that are within our system. So what I've seen, what I've found, and what I've done is that I've identified 10 communities in the city of Houston that have been underserved and under-resourced for decades. And I label them complete communities, like the community in which I was born and reared. Underserved, under-resourced. I come from the hood, Thomas. I still live in that hood. I'm still in that.
And they show up at your door, don't they?
And they will knock on the door. But when you look at where the high levels of diabetes and hypertension, asthma, environmental problems, we talk about needs. So the model has to be augmented so that you can have a value-based system, and oftentimes creating public-private initiatives that can get around those obstacles or where those gaps are. Because what I have found is that in several categories, the federal government provide resources, and they are there. But in that chain, there's a claw. It gets stopped. And then the people who need the resources the most are the ones who are waiting the longest for their needs to be met. And in the meantime, they are getting sick or they are dying. Or they're showing up in emergency rooms. Or they're trying to deal with it on their own. Lastly, what I would say, we see people who are homeless on our streets. Many of them are homeless for mental behavioral health issues. They need those services. As mayors, we can put them in a unit. But if you don't have the sufficient wraparound services, then all you've done is put them in a unit and they will cycle back out on the street. So there are all of these gaps that need to be met. And that's why I commend the administration for what they're doing. But what cities need and mayors need, we need some additional options. Because I don't want to have to fight with my governor and the legislature that's right now engaged in super preemption. I don't want to have to fight for them. And the people in my city, especially in vulnerable communities, black and brown communities, what they are saying, Mayor, we are sick and we need help. Or we don't want to get sick. And so where are the preventive services that it would help that? So those are the things that we deal with on the ground.
You know, Mayor Turner, I will echo that point. We are both Democratic mayors in red states. And as we continue to see this historic federal investment in our states and our cities, the federal vehicles that are going to the states where we as mayors have to go to our governor with our hand out, that's been the biggest challenge of this. And so if I would give the administration one recommendation, the more you can do directly with mayors, the better this whole country will be, and the less headaches we will have as mayors in getting this stuff done.
And if I can just add to that, I'd use an expression that my mom used to say, let's not fatten frogs for snakes. and old school, you know. And basically what it is, don't keep using the same structure that doesn't reach the needs of the folk who are in need of the services the most, just because this is the way we've always done it. Because that same group that's needing health care services on the preventive end or even after they get sick, they still need it. And they're stuck. And cities and mayors have a hard time trying to elevate them. We're using all the tools that we need. And when these resources come, try to find ways to get it directly to us so that we can partner with others who can help to meet their needs.
I want to build on something that Mayor Turner alluded to earlier. this conversation that for a long time in America we've been afraid to have, especially in our community, about mental health. 2 weeks ago, I had the honor to welcome our nation's doctor, the Surgeon General, to Cleveland to really talk about the challenges we're seeing, not just for adult mental health, but for youth mental health. And we had a junior at one of our high schools say something that has stuck with me since she was at the round table with the Surgeon General and I. The COVID-19 pandemic happens. She's on Zoom during her sophomore year or freshman year of high school. And she was doing well on Zoom, had her 4.0. Then 2 years later, she's back in school as a junior. And she said something so profound. She said, I felt as if the world was moving, but I was not. The course load didn't change. The community trauma that was going on in her house and in the neighborhood didn't change. And she went from being a 4.0 student to a 2.5 student, just like that. Now, she's recovered. She's going to college next year. Really excited about that for her. But one of the glaring things that we've identified, not just in Cleveland, but across the country, is just a lack of a strong community mental health infrastructure. And so to the administrator, I'm wondering, how can we begin to work with the administration as mayors to think differently about how we build that infrastructure, not just for youth, but for our parents too?
No, the toll that our country, COVID-19, has had on the mental health of so many people across the board, but particularly at the two ends, right? So our youth and our elders has been just so significant, and is something that the administration is incredibly focused on. What can we do? How can we be helpful? And I'll say a couple of things about what I had alluded to, which are the new changes that were passed by Congress, which we're now in the midst of implementing. So one issue when it comes to mental health services is having enough providers and places to go. And the Bipartisan Safer Communities Act gives more ability for new mental health facilities to join and to get reimbursement. So this is something that is both SAMHSA and CMS, where many, many states, granted states have to apply, but the facilities are the ones that can be clinics, and that may very well be something that mayors can get engaged in about encouraging facilities to come in. And so basically it's the notion of so many people get their care through community health centers. We can have mental health centers where there are places to get services. That is one piece. We also have been really focused on this in terms of Medicaid coverage and really wanting to see mental health parity. We will be coming out with access rules in the coming, we've promised this spring, and that is something that we're very focused on, making sure people who have Medicaid are getting access to the mental health services. And then excitingly in Medicare, the Congress at the end of the year passed an expansion of mental health services. So Medicare does pay for many mental health services from psychologists. Now marriage and family therapists will be included. If, say, everybody who's married needs a marriage therapist at some point. So I'm really glad that Medicare has modernized. Thank you, Congress, for that. And very importantly, there's been a real focus on opioid and behavioral health. And that's something that we're really seeing a rise of. It's really complicating healthcare everywhere. It's complicating our issues in nursing homes where the complexity of the patients has been increasing. I mean, the rise in homelessness across the so many cities. I see it in my visits. I hear about it. And there is absolutely a mental health component to that. And so I just want to say how much the administration recognizes what a crisis this is. We have many behavioral health task force across to really see what we can do, and those are just a couple of the things that, from the CMS vantage point, are areas of focus.
Mayor Turner, what are you seeing on the mental health front in Houston?
There's a tremendous need. In fact, even in the state of Texas, with this legislature, what I've called on is transformative funding appropriations for mental health. Quite frankly, people blame everything on mental health problems. If it's a gun shooting, mental health. Mass shooting, mental health. It would seem as though that the funding would be reflective of that sentiment if people believe that. But we need significant more funding for mental health. I appreciate everything that's been done on the federal level. It needs to be augmented on the state level. And then, of course, people talk about homelessness all the time. I mean, mayors get beat up all the time. But the reality is that many of the people that are on our streets are suffering from mental behavioral health issues, and we need the funding to provide the necessary wraparound services. So there's a tremendous need. And then I don't want to just focus on adults. Many of our kids are in need of those services, and we need to be able to direct a lot of dollars into those services. And then if you go back to the equity equation, what you will find is that there are many, many families who don't have the financial means because they don't have access to insurance or Medicaid expense, you name it, that are dealing with it within the confines of their own walls. And then what ends up happening when the families can't deal with, let's say, individuals within the confines of their own walls, many of these people then end up on the street, okay? Because it just spirals down, and then that's where they land, and then we as mayors and others are having to deal with that serious situation. So the mental health component is something where there is more funding. It just needs to be transformational in place. The state of Texas is, woefully behind when you look at what's being provided there. But I certainly am very appreciative of what's taking place here.
Before we get to audience questions, I want to ask one more question, and we're really close to the nation's capital. We saw Speaker McCarthy come out with his budget a couple days ago. As city leaders, as leaders in this room, how concerned should we be around these conversations around entitlement reform and what that will mean for the future of healthcare for underserved communities of color in the future?
Well, I will just start by saying I think that what we've learned over the last 20 years, whatever number of decades, is you have to continue to build the support for the good things that have been done, for people to know what they mean. And I think that, I can't remember now when we had our big repeal and replace debate here. I think during the repeal and replace debate that was happening in DC, I think there was just such an appreciation of what Medicaid meant to people. It meant a big deal to middle-class families. Middle-class families were getting emails saying services are going to be cut for education if Medicaid is block granted, if there is not an entitlement. And I think it's really important that we continue to lift up what all of these programs, all of these entitlements mean to the people in America. And I would say that the president has made very clear how important health is in terms of his State of the Union, in terms of his budget, and that he's committed to building on the work of the Affordable Care Act. We are now, CMS covers 170 million lives between Medicare, Medicaid, and CHIP, and marketplace coverage. Those are record numbers, and it's largely because of what has been passed in the last couple of years. And so it's really important that we continue to get people enrolled, but also continue to talk about what this coverage means. It means you can change your employer, and you're not making a decision about where you work because of trying to get your health insurance. It's if you make people go through a whole tons of paperwork to prove that they deserve this coverage, it means that people will fall through the cracks. and they won't get what they need, and they won't be able to contribute to the economy, they won't be able to live their best lives, go on and on down the list. It's so vital for everyone to, I think, continue to talk about just how important it is. But I think the president has made clear that he is very focused on making sure that there are no cuts to Medicare, and that we support Medicaid and marketplace coverage and continue to focus on lowering costs.
That's fantastic. Okay, let's open up the floor to questions. We answered every question possible.
Maybe while they're punting, there you go.
Got one from John.
First of all, thank you for what you do. I came from Chicago. I live there, and I enjoy it, and I appreciate everything you do. I myself am a victim of great health care, and I didn't use it. And many men don't go to the doctor. I came very close to a tragedy since I've solved that problem. And I wonder, is there something at the national level and mayor's level to remind people, particularly when you do have health care? First of all, everyone deserves health care. But if you have it, use it. Because I found myself in University of Chicago with 197 over 137 blood pressure. Hadn't been a doctor for 11 years, so shame on me. But I think there's something that a message that might be able to go out to help that.
I completely agree with you, and I've been thinking about this a lot, and particularly as we talk about disparities, that sometimes it's people have coverage, but we don't want it just to be a card in your pocket that you don't use until the last minute. I think this is definitely something where I think mayors can be helpful, because again, it's also one thing that we're learning is we need trusted messengers, and we need multiple messages that you can't just hear, at a high level, some of these messages in terms of care. Since COVID-19, we have severe drops in kid vaccinations for some of the standard things, for example, and it is really vital that we continue to lift up access to care, getting your doctor, preventative medicine, et cetera. This is something that we can try to do in terms of at the national level. We have limited dollars for some of those initiatives, but it is really one where I think of this is where we can continue to partner with the private sector, and certainly with, I think, again, you all who are so much closer to people in your cities.
We do a yearly men's health clinic with Dr. Charles Motlin in Cleveland every year to give our men the ability to get checkups and get a check-in on what's going on with their health. We do a yearly African American men wellness walk to raise awareness around going to the doctor. So I think these grassroots initiatives are so key to addressing that issue. Mayor Turner, you want to add to that?
And we just followed up with you. You all started the National African American Male Wellness Walk. We just did that Saturday in the city of Houston for African American men. Our life expectancy is 12 years less than our counterpart. So we have to speak to it. Mayors, we can speak to it. And oftentimes, yes, you can have insurance, but what we are saying now in the city, what I'm saying to people in the city of Houston, listen to your body when your body is talking to you, okay? And, look, I thought I had a toothache. And took some time on and kept on going, servicing the needs of the people in my city, okay? Until I was getting ready to lead a trade mission to France with about 30 people, and decided, well, I don't want to be going to France with a toothache. So I went to the dentist and told the dentist, hey, look, give me a filling of root canal, and it's about right here. I can tell you right here, so, I don't have a whole lot of time. And then the dentist said, how long that lump been on your jaw? I said, hell, I don't know. Maybe a week or two. Biopsy. And 2 weeks later, I'm 9 hours of surgery on my leg and on my jaw. A bone growth right up there. Okay, so it's important for people to listen to their body when their body is talking, and we need to carry that message. But The fortunate part, I had good health service, health care. But I also think about the people in my district where in one zip code, the life expectancy is 24 years less than the neighboring zip code, okay, in communities of color. Or African-American men who are living 12 years less, okay? So it is important as mayors for us to tell the story, but it's also important for us to focus on those who are constantly on the margin and in a constant state of need and recovery. Yeah. And when you're dealing with shocks and stresses, it affects your health. And stress will affect your health. And that's why I'm a big proponent that we have to come up with all the necessary models, equity, to make sure it drives all the way down and not be limited to the current structure. Mm-hmm. And public-private, I established what we call the Health Equity Response Team. Mm-hmm. Because what we discovered from COVID is still, we were using those same channels, but it wasn't getting to the people who needed it most. Yeah. So we put together a Health Equity Response Team, focusing on, again, those complete communities, those 10, and then we start driving resources and we start working with members in the public and the private sector to make it happen. Yeah. I think the same thing is needed here, a value-based system, something that works and something that will move the needle so that those folk who don't have access, it's not affordable, we can bring those numbers down and reduce those disparities.
Well, Mayor Turner, in my house, we call that a testimony. So let's thank God for Mayor Turner's leadership. We were praying for you, too. Thank you, Mayor. Question?
Mayor, I appreciate what you just said. That sort of somewhat answered my question. I sort of thought that maybe I might not stand up and ask this question now, but you were very thorough with what you said. But I do understand in some insurances they have the silver sneakers for the seniors groups, but then there are the middle-aged groups that who probably can't afford that preventive maintenance. And then you were talking about resources that would drive that. And then there are those that you were speaking about that have no access to insurance at all. So what resources would those be, and what type of systematic drive would it take to make those things happen?
Well, let me put the administrator on the spot. You know, she operates with $1.4 trillion. Now, okay, 1.4 trillion with a T. With a T. So
I will take that.
I have one question.
Oh, sure.
Before you speak, I want to turn my recorder on.
And it's a recorder, y'all.
That's an old school tape recorder, huh, bro?
that's an old school player right there.
Yeah.
With the film attached, no.
Administrator.
Yes. So I would answer your question a couple of ways. There are different programs, and some that are run by the federal government, Medicare, Medicaid, Marketplace, Affordable Care Act. And under those programs, they all have different benefits as established by Congress. There's some discretion that different insurance companies have about what kind of benefits they offer, and so there are ranges, and there are ranges based on where you live, which insurance company you enroll in. Part of what our role is establishing some of those floors and requirements, and as we hear of issues, when we have authority, we address those. One of the questions that you're asking is, what about the uninsured? And what happens if you don't have access to coverage? And from a CMS perspective, what we're trying to do is get as many people enrolled in the coverage that we administer. We encourage states to expand. We encourage them to expand Medicaid. We encourage states to expand postpartum coverage, 12 months, things like that. There are other programs run by other agencies that give money for the uninsured, HRSA, SAMHSA, to name a few. But it's really critical, I would say, for us to continue to make sure that people have coverage, because that is one of the main things to make sure that people can have access to services.
We got time for one more question.
Thank you. My name is Elisha Hall. I'm with Compassionate Choices, and I know we talk a lot about social determinants of health, and we know that there's medical apartheid and medical racism, and you know, the nurses, National Association of Black Nurses and other nurses just released a report about the racism still happening today within the healthcare system. So I guess my question is, what do we do? What is to be done in terms of medical reparations?
Well, I think
Mayor Turner, I guess I'll go to you to start that one.
I like that question.
That's a good question, brother.
Well, I think the direct response is having true equity throughout the entire continuum. We on the preventive end, because what leads to health disparities is that when there are energy deserts, food deserts, economic disparities, housing disparities, all of those things will add to create conditions that will impact your health. We need to address them. And then, of course, when people do find that they need healthcare assistance, I think we have to make sure that we have a number of models in place to address that. So equity all the way down. I will applaud the Center for Medicare and Medicaid on their innovative technologies. And for the first time, there's a health equity plan that's required, where they have to come up with demographic information. Both the AAMA as well as the U.S. Conference of Mayors have endorsed those plans. That will help. So I think that adds to addressing those disparities. And to me, that's the greatest form of health reparations, is moving people from that vulnerable status where they don't have what they need to the status where it becomes affordable, accessible, and readily available. And then lastly, to go with Mayor Bibb's, what he said earlier, and what I would ask the administrator, if there are any kind of ways, or we can think of ways where CMS can come up with either grant opportunities or some way of partnering with cities or local units of government, cities and counties, whoever providing those services, where we can be innovative and working with partners who can be even more intentional and directional in working with vulnerable, marginal communities for healthcare services. That's the other thing that I would ask.
Yeah. To your point, I think we need a Marshall Plan in this country to have more Black and brown healthcare physicians. I read a study from Berkeley a couple weeks ago, and it talked about how in the Black community, and I never realized this until I read the study, why my mom would make me dress up to go to the doctor. Because we were less likely to get the care we deserved if we didn't physically look clean enough as a people to go to the doctor. So we need to diversify having doctors who look like us in our hospital rooms, because to me, that's one of the only things we can do to eradicate medical racism in our society. And we have to find a way to diversify these pipelines.
If I could just add to both of your incredibly important points. On the diversifying the workforce, I agree, and I would add not just our doctors, but really our nurses, and making sure that, I mean, a lot of times it's your nurse who's gonna know whether you're in pain, whether you see the symptom, pulling the doctor, et cetera. And it's something that I think you wanna make sure, certainly, that we have a diversity of providers that have a diversity of experience, where, again, you have a trusted messenger sometimes when you have something in common with them. You understand where they're coming from. And I think especially as our population gets more diverse, is that telling me I'm talking too much? As our population gets more diverse in who's here, and how they came here, it's incredibly, incredibly important that we continue to support that. And I would just say to us, and it's something I'm hearing about a lot from so many stakeholders are saying, please figure out how to partner with us more. We have some limitations, of course, because of our relationship with states or directly with providers. But one of the ways that we are really trying to think about is how do we use our Innovation Center authority, our waiver authority, and also how do we do these partnerships where maybe there's a private sector entity that is working also with the city because we tend to have a more direct relationship, say, with the hospital or with the healthcare plan, et cetera.
And because the point, what is so poignant to me, in this hood in which I live, grew up, at most we may have had one doctor, two. Even today, but for a collaborative between the pharmacy and health providers in one location, no doctors in where the mayor lives, okay? Which means to get the health care we need, got to go outside. Now, let me tell you what's pressing on my part. I am the mayor of the largest medical center in the world. It's right in the city of Houston. And what I've said to them, in the shadows of the greatest, there are zip codes where people are dying 24 years less than the next. Okay. Now I've benefited from it. But there are so many others who need to benefit from it. So as mayors, we try to come up with innovative ways in order to address the needs, because we are only as, how can I put it, effective as those who are the most vulnerable can get what they need to move forward. So those are the things I think as mayors we grapple with, okay? And that's why we are constantly looking for ways to meet the needs, the healthcare needs of people in our communities. It goes directly to what you have to say. Reparations, equity, meet the needs where they are. We have to see them, feel them, understand their pain, and understand why they are where they are today. And in these communities are some of the smartest people you will find. But we will not be able to take advantage of their brilliance if they are sick and dying young.
That's right.
So we have to address it.
Well, the journey towards progress continues, but I think we're in good shape with these two leaders. Let's give them a round of applause if we can. Thanks so much, everybody. We appreciate you.